Now that we have taken one example about patient who comes to physician with complaint of chest pain and angina and shoulder pain and left side chest pain and everything, let us take one another example, this time a totally different domain. So we are telling the chat gpt and we are giving quite a detailed prompt actually, that this is what is the prompt. You are an expert psychiatrist. A female patient comes with complaint of mood swings characterized by more episodes of angry and reckless behavior, reduced focus, reduced attention span, and few episodes of downfilling with anxiety. She is having some marital conflicts and also passing through job related stress. She is 48 and also having irregular periods. Suggest some differential diagnosis for her. With each diagnosis, this time we are increasing the scope. With each diagnosis, suggest possible specialist which she can consult and possible tests which she would be asked to undergo. Also, with each diagnosis, suggest lifestyle improvement measures she should take. Meanwhile, her problem is sorted by the expert doctors. Give your answer in a tabular manner with one column having symptom in different rows, second column with possible diagnosis, third column with specialists which she should see and test which she should conduct, and fourth column for suggested lifestyle changes. Okay, so now then let me test this. Of course, I have given a very long prompt. Often ChatGPT works better with two short prompts, which we have seen actually zero shot prompting and one shot prompting and all that. But I am trying this time to give this long prompt. Okay. Otherwise, starting from this point with each diagnosis suggest, so you can try first only the portion above it and then with respect to your answer suggest possible specialists. You can do that way also, but I think it should be able to handle this. Let us see. And you can see that it has already started making a nice table as we demanded. The table has symptom, possible diagnosis, specialities and tests, and lifestyle improvement measures. Now, symptoms, mood swings characterized by anger and recklessness. Then, bipolar disorder is one possible diagnosis, and psychiatrist she should see. Reduced focus, again, it is hyperactivity. So, ADHD, attention deficit hyperactivity disorder. Again, it is the domain of psychiatrist, which is she should see. Episodes of anxiety, again psychiatrist domain. It is possible that she is passing through major depressive disorder. Marital conflict, job related, that is an adjustment disorder. For all these psychiatrist or here psychologist who can give some psychotherapy can work. Irregular periods, now this is a little bit gray area because it might be menopause or hormonal imbalance. So psychiatrist may not help, but gynecologist, endocrinologist, that they can be of help. Okay. Now this is the diagnosis which she has been given, and in one column you can already see that it has already given lifestyle improvement measures also. So by the time the doctor's appointment is obtained, and by the time uh, the problem is sorted out, some relaxation or some at least relief can be obtained by adopting these measures. And particularly in psychiatric domain, these things are important because sometimes, unfortunately, it happens that patient who is having suicidal tendency even before he reaches the doctor, uh, he take some drastic action. So it is good to suggest some lifestyle changes which makes the life bearable, at least until and unless the person gets proper treatment by a qualified medical professional. Okay. So I will perhaps paste this, and since this this notepad cannot preserve formatting, so I will try to paste it in from copy from ChatGPT and paste it in words. Hopefully, the table will be maintained. No, it cannot maintain that. Okay, anyway. So then I will have to at least make the table with one, two, three, four columns, and one, two, three, four, five, six rows. Okay. So insert table, and then four column and five rows. Fine. And I will now copy it this way from the ChatGPT website, and control C, and here I try to paste. Yes, this is working. But you can see a lot of work is again saved. Okay. And doctors are under obligation nowadays to not only treat the patients but also to educate the patient. And they have to create patient education literature. So this will save a lot of time in such thing. Okay. Thank you.